It's World Continence Week, you might not know that, and Lisa Yates and Fiona Ross are back with Filifit. Pelvic floors, it's so important, it's all anyone's talking about. Ladies, welcome back to the show.
Thanks,
yeah. What are we going to be doing over the next 5 days?
Well, as part of World Continence Week, the New Zealand Continence Association is involved in an initiative called Pelvic Floor First. And that's really all about getting people exercising in a way that's safe for your pelvic floor. Now, we all know that exercise is good for us. That's common knowledge these days. But what a lot of people don't know is that almost every exercise you do affects your pelvic floor. And that some
in a good or a bad way?
Yeah, well, it depends on what sort of exercise you're doing. And that some exercises actually can be detrimental to your pelvic floor, possibly worsening symptoms or even causing problems to start in the first place.
Actually, that's what Dr. Anil Sharma has talked about on the show earlier. Like sometimes big squats with heavy weights can be quite hard on the pelvic floor.
Sometimes it's those exact exercises that can cause symptoms or make people's problems worse. So what we want to look at today is safe exercises to get everyone exercising, to keep people that have got pelvic floor problems exercising safely.
So it's exercises that strengthen your pelvic floor or don't damage it. What are we doing?
A bit of both. What I want to teach you today is about the pelvic floor and where it is and how to engage it while you're exercising. But we also want to look at exercises that actually could worsen, gym-type exercises that could worsen your symptoms.
All right, so, and how to avoid them.
Yeah, and how to modify your program to make it safer.
All right.
Okay, so let's just review the pelvic floor. This is your pelvis, and it sits here, okay? This is your pubic bone that you can feel at the front, and this is where your spine comes in at the back.
Okay.
Now, the pelvic floor muscles sit in here, okay? So you can see that they sit where my hands are, and their main role is support. If they weren't there, the pelvic organs, the bladder, the uterus or the womb and the bowel would potentially not fall out, but they would...
But it can in a prolapse.
Absolutely. So that is their main role, is support. And the other thing that people will have heard of is that they help to close around those openings to keep us dry or to prevent us leaking urine or from the bowel. Okay, so they help to squeeze around the openings. And that's essentially how we get the pelvic floor working. So if everyone at home wants to try this, you can sit up on your chair. We're just going to try it.
You can do it when you're standing too.
We can do it in standing. We're going to do it once in standing, and then we're going to get it down on the ball and on the floor. Okay. So I just want you to imagine that those pelvic floor muscles are squeezing in and up, trying to stop yourself from having a wee. So we're trying to stop a wee, we're squeezing in and up, and then we're letting go. Okay? No one should be able to tell that you're doing them.
I can't help but make a face.
Yeah, well, lots of people do this sort of thing. All right, so then Fiona's going to get us exercising now, and we're going to look at how we can incorporate this pelvic floor squeeze into all the exercises that you do, perhaps in a gym program or your normal workout.
All right, so should we get into some exercise then?
That's cool. So, come up onto your mat, all fours. We'll have some music, thanks.
Okay.
So let's pop our hands underneath our shoulders.
All right.
We're going to find the neutral position, which means our lower back has a little bit of a curve, but we'll do the opposite. So make sure your knees are under your hips and your hands are under your shoulders. Relax your shoulders away from your ears, Sarah, and just keep your eyes looking down to the ground. I want you to round your back up as though you were sort of making a sort of cat arch. And then I want you to go the opposite way, so drop the arch and stick your butt up. That's lovely. And again, round the back up. Excellent. And then drop.
And all the time are we thinking about squeezing the pelvic floor?
Well, we're just about to do that right now. So we're going to come into this sort of a middle position, so not quite the big drop down through the lower back and not the big cat arch, just kind of a neutral position. And here we have got that little squeeze into our pelvic floor now, Sarah. So if you can hold that, take a breath in. And as you breathe out, I want you to just gently think about squeezing that pelvic floor. Let's do that one more time. Breathe in. And as we breathe out, just gently squeeze that pelvic floor and
so when
lift
we're breathing in, do we relax?
That's right. So let's try and gently hold that pelvic floor sort of lift and remove one leg. So let's take our left leg and stretch it out behind us. So nothing else should move. Our hands should stay underneath our shoulders and gently bring that leg down. And let's try the other side. So you might notice one side feels a little bit easier than the other. So remember, nothing else moves. You're going to try and keep that neutral position through your back and release it down. Let's try a right hand this time. So again, gently extend the arm and think about lifting into that pelvic floor and gently bring that arm back down onto the ground. Try that left arm, reach it out, nothing else moves, keep that neutral position through your lower back, and then gently take the hands down. This time we're going to do opposite leg, opposite arm. So let's reach it out, and again, keep that neutral position through your lower back, and gently lift that pelvic floor and release those arms and legs down to the ground.
This is going to have to be our last one.
Okay, and gently one more, all the way out.
All right.
And gently bring it back down.
Great.
Excellent.
Oh, well, thank you so much, ladies. Great to be doing this program this week. I'm looking forward to it, and I'm sure everyone at home will be as well. And Fiona and Lisa are going to be back tomorrow with more, including tips on exercises to avoid if you have a weak pelvic floor.
Thank you so much for that, Sarah.
While some exercises stress the pelvic floor, there are always alternatives. Lisa Yates and Fiona Ross are in with some safe, low-impact options. Ladies, welcome back to the show.
Thank you.
So what exercises are particularly bad for the pelvic floor area?
So anything that increases the intra-abdominal pressure. Now that's just a big word for saying that anything that puts a downward pressure on the pelvic floor. If you remember where it's sitting,
yes.
It's here. It's like a bit of a platform or a trampoline. So if you can imagine star jumps, jogging on the spot,
yep.
Any jumping type activities, a lot of running, high impact sports like netball, basketball, where there's quick direction changes, a lot of sort of athletic type sports, sit-ups, crunches, a lot of
sit-ups, but we love sit-ups.
Yeah, absolutely. And this is a common thing. Women often come to me after having babies saying, when can I do sit-ups again? Probably the best way to explain why sit-ups can be detrimental is to show you. Would you like to have a lie down, Sarah? You get to do a sit-up on TV.
Don't worry, Sarah.
I'm just what are you going to do with that balloon? I'm just going to put this to the side.
Right.
Because, I mean, sit-ups are our mainstay. Before we do this, how do you guys get your completely flat abs then?
We'll show you after we've shown you this one.
By doing deep tummy exercises and pelvic floor.
Okay.
It is a fallacy that sit-ups give you a flat tummy.
Oh.
There's a lot of people that think that. Not only do they not necessarily give you a flat tummy, but they can cause pelvic floor dysfunction. And we're just going to demonstrate that. So this is your bladder, Sarah. It's very full. You've had a big drink. Now, I want you to, now this is your diaphragm here and your abdominal contents. I want you to do a sit-up for me.
Okay.
Oh, now what happened there? My fingers here are the pelvic floor muscles around the bladder, okay? So when there's an increase in pressure and the pelvic floor muscles aren't as strong as they could be, this is what can happen. Just try again. Oh, Sarah. Oh, no. So this is an example. It's as simple as that. If the pelvic floor muscles can't close tightly around the urethra and around the back passage,
from this pressure of...
there's a lot of pressure downwards on the pelvic floor, and that's especially why women that have just had babies should not be doing sit-ups.
Until when?
Until their pelvic floor muscles are nice and strong. All right. And until they've got good control. And as we said, sit-ups aren't the best exercise to get a flat tummy anyway.
What is?
I'm going to show you now.
Shall I get back to my mat so you can do your demonstration?
Yeah, we're going to come back onto our all fours again.
Okay.
But this time we're going to come down onto our tummy, Sarah, and on our elbows.
All right.
I'll have music, thank you. So our elbows are under our shoulders, Sarah.
Yes.
All we're going to do is remember to gently squeeze and lift that pelvic floor as we lift our hips off the ground. So try and pull your shoulders away from your ears. And again, just gently think about lifting that pelvic floor. Do remember to breathe. Keep your eyes looking down towards the ground. And tell me if you can actually feel your tummy muscles working in this position. Yep, that's cool. And gently relax all the way back down. So if you've just recently had a baby or not recently, we want to definitely be staying onto our knees and come back up again, lift those hips. And gently release it back down. Excellent, let's try that one more time. Lift up onto your knees, pull the shoulders back, remember you're breathing. Gently lifting that pelvic floor.
Don't forget to breathe.
And don't forget to breathe.
It's so easy to forget to breathe.
Absolutely. And release it down. Let's just try one more time. Now there is an advanced position from here, and I will show you it, but you will only be doing that if you can comfortably hold the other one for at least 20 seconds on your knees. And gently come down. Excellent. Please bring yourself up and let's come sit on. Let's grab our bands, and let's pop them across the mat. We're going to stand on the band. You spoke about squats earlier on, Sarah,
Yes.
and I want to show you a slightly safer way to do your squat. Tuck your thumbs underneath the handles. Your feet are about hip distance apart, so we don't want a wide squat if we've got a weak pelvic floor. You want toes slightly out, chest nice and lifted, and we're just going to come down in 2 and gently come up in 2. So Lisa will always stay with a slightly easier option, Sarah. We're going to slightly give a little bit of a shoulder press with one arm. Down for 2, and coming up for 2, and a shoulder press with the other arm. So remember, just gently lift that pelvic floor. Breathing, and keeping that chest up nice and tall. Excellent. Let's just try one more on each side. Coming down for 2, and a shoulder press. Last one, coming down for 2. Tummy is in, pelvic floor is lifting. Excellent.
So the pelvic floor is lifting the whole time with this?
You definitely have to relax in between each movement.
Oh, okay. And
so you're not holding it all the
it.
time, you're just engaging it. Let's try that one more time and think about that.
So more with the downward.
So as we go down, yep, gently lift that pelvic floor.
And then as you relax up, you stop doing it. Right, we're going to have to leave it there, ladies. But that was excellent and so interesting. I'm just a bit upset about the sit-ups are no good, but there are other options, and that was pretty hard, that planking.
Yes,
so,
it is very.
Very cool. Thank you so much. We'll look forward to seeing you tomorrow. Tomorrow, Fiona and Lisa are going to do some more of those pelvic floor friendly exercises. Lisa Yates and Fiona Ross are back with more pelvic floor safe exercises. Ladies, welcome back to the show.
Thanks, yeah.
Before we get into our exercises, who is most at risk of developing pelvic floor problems? I presume women who've had babies.
Yeah, absolutely. So
yep.
pregnant women, it's quite common for them to have some sort of pelvic floor problem while they're pregnant, and then postnatally they're a little bit at risk while their muscles are weaker. Also women who are surrounding the menopause, pre and post menopause, and then women that may have had gynecological surgeries such as a hysterectomy, and actually men who have been going through treatment for prostate cancer. Sometimes they've had surgery for the prostate cancer, so that puts them at risk. And the other group, which a lot of people don't know about, is actually elite athletes. They're at risk of having incontinence and pelvic floor problems because of the repetitive bounding, especially in sports like trampolining, gymnastics and running.
Didn't know that.
Yeah.
What are the main symptoms that you've got? How would you know you've got something wrong?
There's lots of symptoms, but the most common ones that women talk about, and you'll see them on the TV, is leaking a small amount of urine when you're doing an activity like jumping or coughing or laughing or sneezing or exercising. That can also happen with your back passage, or sometimes you lose a bit of wind from the back passage. The other really common thing, and we don't talk about it as much, but it's actually even more prevalent than incontinence, is the symptoms of a prolapse. So what that is those pelvic organs, the ligaments in the pelvis are weakened, and because the pelvic floor is slack, they drag down a little bit. We call that a prolapse. And the symptom you feel is a bit of heaviness or dragging, but to get it diagnosed, you really need to see a health professional.
That's right. Well, today we're going to do a few more pelvic floor friendly.
Safe exercises.
Safe exercises. So shall we get into it?
Yeah, please pop in your mat. We're going to lie on our back this time, see?
Okay.
Music, thank you.
Okay.
So let's just check. You can almost touch your heels with your fingers, Sarah, and that's how far away you want your feet.
Okay.
Shoulders are comfortable on the ground. We're just going to gently peel your spine up off the floor and just gently lift that pelvic floor at the same time. Remember to breathe. A little squeeze of your butt, and then slowly peel that spine back down onto the floor. So this is called a bridge, Sarah. And again, push up through the heels, peel that spine all the way up, gently lift that pelvic floor, breathing, and gently bring it all the way down. So just make sure the emphasis is on pushing up through the heels just to get your butt muscles working and those pelvic floor muscles working. And gently bring it back down. We're going to turn onto our side, so let's all come towards me. So your elbows under your shoulders. Everything's in flush. You're going to lift up those hips. Again, gently draw in that pelvic floor. Make sure your shoulders are stacked on top of each other. Let's reach up with one hand. Make sure you're breathing, gently lifting that pelvic floor. And you can actually feel what's happening, Sarah. So if you pop your hand underneath in your bottom waist and then check your top waist, can you feel the difference?
They both feel very flabby, unfortunately.
I don't
That's the wrong
believe it.
answer. And gently bring yourself down. Let's flip our legs round to the other side and try the other side. So let's hope this is a little bit different. Let's, again, everything's flush, elbow under the shoulder. Again, gently lift that pelvic floor, gently lift the hips. Make sure the shoulders are stacked on top of each other. And have a feel this time and see if you notice a difference, Sarah. Any difference?
I just can't feel through the fat. What am I meant to feel?
I'll feel for her. Oh, look, the muscles are working.
Oh, really?
Excellent.
Yes, there they are. Feel that.
Oh, yes, I can feel them underneath.
Good girl.
And gently bring it back down. Let's come back onto our backs. So remember, you almost touch your heels with your fingers. You know you're in the right position. So remember, we're peeling our spine up off the floor as though you were playing a piano, so every vertebrae is touching the floor.
Okay.
All the way up. Little squeeze into the butt by pushing up through the heels. And don't forget to just gently lift that pelvic floor and slowly release all the way back down. And again, tuck your chin in, so keep your chin and your neck nice and long there. Again, peeling that spine up off the floor, squeeze into the butt. Make sure you're breathing. And slowly bring it all the way back down. Let's try one more time. And again, peeling that spine all the way up. Little squeeze into the butt. And gently bring it all the way back down. Come back over onto your side. All right. And again, just last little lift. Everything's flush, elbow under the shoulder. Gently lift the hips and gently lift the pelvic floor. You're gonna have to practice this one, Sarah, a little bit more.
I know, I think I need
Not
to go
a
up.
sit-up inside, girls.
Not a sit-up. Excellent for your obliques. And obviously, very safe for your pelvic floor. We're not putting any pressure on that pelvic floor. And gently release it down.
That's amazing, because it is really effective. We're going to have to leave it there today, ladies, but it really is effective, and yet I can see you're not doing that pushing and stressing your pelvic floor. Thank you so much for coming in. And Fiona and Lisa will be back with more exercises tomorrow. Well, it's World Continence Week, and we are conditioning the core and the pelvic floor with Lisa Yates and Fiona Ross from Filifit today. We're going to look at how menopause can affect women in this way. Welcome to the show again.
Thanks, yeah.
Are women who face menopause likely to have pelvic floor problems as well?
Absolutely. I work as a continence practitioner, as a physiotherapist. One of the main groups of women I see, obviously, are the pregnant and postnatal women, but then the other big group is actually women once they get to menopause. Now, the main reason for that is muscles tend to weaken when we reach menopause, and one of the factors behind that is that we have a decrease in estrogen in our tissues. And certainly in the tissues of the pelvis, that means that they're less elastic, which contributes to leaking urine, more like stress incontinence, all those prolapse symptoms that we talked about. The other thing is that muscles tend to weaken on the whole, and often women gain a little bit of weight and get less active at that time, and that can contribute, you know, the weight gain can contribute to pelvic floor problems as well.
So is it the same way that you address pelvic floor problems in a pregnant and postnatal woman as with a menopausal woman?
Menopausal women often are referred by their GP, so if they need any other therapies, any hormonal therapies, then the GP can contribute and help there. But absolutely, you can strengthen muscles at any age.
Never too late.
Never too late.
That's good to hear.
Because the pelvic floor exercises are all about strengthening those muscles. So yeah, treatment is very similar.
All right, well, shall we get into a bit of treatment?
Absolutely. Let's grab our balls this time.
Okay.
And we're actually going to sit and we're going to lie on our balls. So have you feel
like
comfortable lying on your ball?
Yes.
You can have music, please.
All right.
So just make sure your head and shoulders feel nice and comfortable on the ball. You can kind of use your arms for a little bit of balance as well. Now, you're not allowed to roll up and down the ball. All you're going to do, Sarah, is again just gently think about lifting that pelvic floor, and you're just going to drop the hips down towards the floor. And then you're just going to gently push the hips up. This is actually using all the same muscles as you would use in a squat. Drop those hips back down.
Without the pressure.
That's absolutely, yeah. And gently lift those hips up. So again, just gently drop the hips down, gently lift that pelvic floor. So you should feel nice and relaxed in your upper body. Gently lift and squeeze that butt at the top. And again, slowly release it down. Now, if you were in a gym, you could always add a little bit of a weight across your hips.
And that would not strain you?
And that wouldn't strain, as long as you're feeling in control and you're able to still lift that pelvic floor.
Just a slightly more advanced option.
That's right. Let's try one more. How are you finding this, Sarah?
Good. It's quite hard to balance, but I'm good.
So this time when you come down, I want you just to let your bottom come down to the floor. So it's probably the safest way to come off your ball. Put your hands on the floor and come all the way down. Look at that, lovely and gradual. Come and grab your bands. So we're going to work our outside butt muscles and our pelvic floor and our core muscles. So stand on the band, tuck your thumbs underneath the handles and turn your toes slightly out. We're going to travel to the side. So keep your chest nice and tall. Make sure you're breathing and make sure your toes are slightly out to get those outside butt muscles working. Travel the other way. Excellent. Are you breathing? Give me 2 more on this side and let's hold it here. We're going to come back to that squat, Sarah.
Yes.
So let's go down in 2 for that squat. And then we're going to turn towards you, Sarah, and squat out the other way. Down in 2. Keep hold of your bands. Come back towards me. Down in 2. Excellent. So remember, lift that pelvic floor. We're going to go towards Lisa this time. Coming down for 2. Lovely. Coming back to the center. Down for 2. Remember that pelvic floor. Remember you're breathing towards Sarah this time. Excellent. Down. So remember, push your butt back. That's better. That's lovely. And come back to the center. Down in 2. So your butt goes back as though you're trying to sit on a seat towards Lisa. Down in 2. We've got 1 more. Come back to center. Toes slightly out. And let's hold it at the top and let's do our funny little walk. So remember, shoulders back, knees nice and soft, toes slightly out. And breathing.
I keep forgetting to breathe.
Breathing is really important.
Yep. And let's go the other way. Excellent.
If you don't breathe, your pelvic floor won't work as well.
Is this Katy Perry?
This is Katy Perry.
I'm
And
so down
travel
with the
back.
Yeah, we're with the kids. Young at any age, remember?
That's right.
Let's hold it here. Give me 1 more squat. Nice and slow. Push that butt back. Excellent. And slowly bring it back up.
Wonderful. So 1 more day to go. Ladies, great to have you here today, and we'll look forward to tomorrow. And for more information on Filifit, please see our website, tvnz.co.nz/goodmorning. Lisa Yates and Fiona Ross from Filifit are in with 1 final set of pelvic floor safe exercises. Ladies, welcome to the last day.
Thank you.
So what we're going to focus on today is, how do you know whether your exercise regime is pelvic floor friendly?
Okay. So first of all, it's about knowing whether you need a pelvic floor friendly exercise regime. Certainly if you have any symptoms of pelvic floor problems that we've talked about, like leaking or the heaviness, or if you're unsure, then it's always important to go and see a health professional to get that diagnosed. But while you're waiting to see them, in the meantime, if you're exercising, it's a good idea to decrease the impact of your program. So if you had been running or lifting heavy weights, try an alternative form of exercise such as swimming or walking, or more low impact core exercises like we're doing today. Yeah, and if you're not sure and you want some guidelines, the New Zealand Continence Association have put together these lovely brochures. One of them is for fitness instructors that they can use, and the other one is for anyone attending a gym. And it's got some suggestions about how to make your program more pelvic floor safe and friendly and less likely to cause you problems.
So how can people get hold of these? Because I know they're free.
So they just need to go onto the TVNZ website, and there's a link there to the New Zealand Continence Association, and they'll send them to you for free. They'll even send you multiple copies if you want to keep them in your gym or in one of your businesses.
Oh, that's excellent. So it's got a lot of good advice in there.
Fantastic resources. Yeah.
All right. So for our final day, shall we get into a bit more of our pelvic floor friendly exercises?
Absolutely.
You can take it away.
Let's come back on the mat.
Okay.
Thanks for the music. So we all like doing press-ups, don't we, Sarah?
My personal favourite.
So come down onto your hands.
So sit-ups, press-ups are okay?
Press-ups are okay as long as you can gently lift your pelvic floor as we go down.
Okay.
And You don't need to go all the way down to the floor. We can just take it in stages. So make sure your shoulders are away from the ears. Head's looking down towards the floor. Just gently think about lifting that pelvic floor and slowly coming down in 2. And I want you to think about your shoulder blades coming together and then slowly push up for 2. So if you go all the way down, that's the hard bit to get from the bottom up. So maybe just go halfway. Let's come down for 2.
You can follow me for the easy version.
And gently up for 2.
I wish I could. I'll have to do the hard one.
So make sure, Sarah, you keep your hips up just a fraction more. And you think about just gently lifting that. That's better. And now gently come down. That looks 100 times better. That's lovely.
And what does that do by having your hips up a bit more?
It stops putting any little pressure on your lower back, but as long as you're thinking about using your pelvic floor muscles as well. So we're going to make it a little bit fancy. We're going to do one little press up, Sarah. And then we're going to flick our knees behind us, and we're going to reach out to the side. So we're kind of working obliques. Think about pelvic floor. A little bit of balance on that one arm. Come back to your press up.
I find those press ups hard, I have to say. Was that normal?
It is hard. Women are generally weaker. Let's go to the other side. So flick your knees behind. That's it, and reach up. Lovely. And again, come back to your press up. Press ups are definitely harder for women.
If you find it really hard, I'm going to do a much easier version.
Oh, okay.
You can leave your bottom in the air.
Oh, I see.
And gently come over to the side. Well done, Sarah. Let's try one more time. Little press up. And gently come over to the other side. Now, because it's the last day, Sarah, we're going to have a little bit of fun, so I want you to stand up. And as you get a little bit stronger with your pelvic floor, you need to include a little bit of balance.
Okay.
So we're going to need to be quite close, because we're going to be passing the ball amongst us.
No,
so you're on one leg. You're on one leg.
All right.
Chest up.
I'm going to do the basic. I get to stand on 2 legs.
Okay.
So what I'm going to do, every person that gets the ball has to touch the floor with the ball on that one leg. I'm going to pass it to you. Woohoo!
Can't believe I caught it.
Gently holding that tummy in, pelvic floor. We're coming down towards the floor, tipping from the hips. Great balance. And you're going to pass Elisa.
Lovely.
Woohoo! Excellent. And again, gently holding tummy. We're staying on that one leg. We're going to touch the floor.
Even though we haven't got a ball.
Even though we haven't got a ball, we're just still practicing. And so Lisa's going to pass it to me. Let's change sides.
Okay.
So we're on the other leg. So keep that knee nice and soft. Gently think about lifting that pelvic floor and tip from the hips, coming down towards the floor.
This is a gentle way of challenging your pelvic floor, making it work a little bit harder.
If you were on your own, you could do the same thing. Let's come back down towards the floor. And you could just pass the ball against the wall. So you would do the same thing.
Looking at the wall.
And you can pass to Lisa. Excellent. One more time.
But it's fun if you have a training partner.
Absolutely, yeah. Or if you're doing it with your kids, you can kind of do it with your kids for a bit of fun. Well done, Lisa. And Sarah, come and grab your bands.
All right.
We'll do one last exercise just to finish.
Just 30 feet.
Is it 30? Standing on the band. I'm going to turn side on. We're going to lift her up to the ceiling, and we did a bit of press-ups for her chest. We're just going to finish and work into the back. But again, think about lifting that pelvic floor and squeezing those shoulder blades together. Head looking down, and your back kind of looks a bit like a ski slope.
Okay. All right, we'll have to leave it there. But that has been so brilliant this week. Thank you so much, ladies. I've really enjoyed it. And I've learned a lot, and hopefully a lot of people at home will have as well. Thank you very much. And we have 5 copies of Fiona and Lisa's Filifit, the Core and the Floor DVD to give away today. Just tell us what Fiona and Lisa's focus has been this week, if you didn't know. Post your entry to the address you can see on screen, or you can enter online by following the links in our competition area.